Hello and welcome to the Heart Health series. This episode is going to be over diabetes and blood sugar. It is presented by the Abilene-Taylor County Public Health District. So starting off with the definition. Whenever we're looking at the topic of diabetes, we want to look at primarily two different things, which is glucose and insulin. Glucose is our body's main source of energy, so it is made whenever you're eating sugars and carbohydrates. So there's a lot of different things that affect glucose, such as how physically active you are, genetics, as well as how you consume carbohydrates and sugar. And then insulin. So insulin is a hormone that is released by the pancreas. This helps our cells absorb glucose. So, whenever your body produces that glucose in order to consume it for energy, this is the thing that helps our cells actually use that glucose. Insulin and glucose are both needed to understand diabetes as well as heart health, because diabetes interacts a lot with your heart health. A way to think about it is that your body eats stuff, it makes glucose, and then insulin is what's supposed to kind of suck it up and use up that glucose. However, if you don't have enough insulin or if you have too much glucose, then that can cause some problems. One is potentially prediabetes. So, about 1 in 3 people have prediabetes. That's equal to about 96 million in the world. And just about 80% of people do not know that they are prediabetic. Prediabetes is whenever your blood sugar levels are higher than normal, but they're not just yet high enough for diabetes. Oftentimes, prediabetes ends up developing into type 2 diabetes. And knowing whether or not you're pre-diabetic can really help with preventing type 2 diabetes from occurring. So then what is type 2 diabetes? Type 2 diabetes makes up about 90 to 90% of diabetes, so it makes up the vast majority. This is whenever the blood sugars are too high for too long, and typically is whenever your body becomes insulin resistant. Becoming even more common in a lot of our population, but is becoming rather common in children, which it used to not be very much before. However, type 2 diabetes can be prevented and it can also be managed, whether by life changes or with medication. Then type 1 diabetes. So this makes up about 5% of diabetes. This is whenever your body is unable to create insulin. Type 1 diabetes most commonly develops during early adolescence and late childhood, however, it can also develop during adulthood. And as of currently, there is no known way of preventing type 1 diabetes. However, there are treatment methods in order to manage it. Then gestational diabetes. This happens in about 2 to 10% of pregnancies. This is a type of diabetes that only occurs while pregnant. Almost 1/2 of people with gestational diabetes develop type 2 diabetes later on. So having gestational diabetes is a pretty high risk factor for developing type 2 diabetes. When looking at diabetes management, there's something known as the ABCs. So typically this is to prevent diabetes from occurring or to become aware of where your diabetes status is. First one is to take the A1C blood test. So this is a blood test that measures your glucose levels and gives a pretty solid idea of if you are at risk of diabetes or if you have diabetes. Another one is blood pressure. Having high blood pressure makes you more likely to have diabetes, as well as it relates to a lot of different heart conditions. Your heart. Same thing with cholesterol. So having high LDL cholesterol or bad cholesterol is also associated with diabetes as well as other sorts of chronic diseases. And then S is to stop smoking. So by not smoking, you can remove one of those risk factors of developing diabetes. So one way to understand blood pressure is by kind of understanding how exactly blood works through your body. So blood is all throughout your body. And as that blood is traveling through your body, that oxygen becomes used up. So the blood has to go through the lungs where it then becomes oxygenated and then it continues its course throughout your body. A better way to understand blood pressure is that it is the force of blood against the walls of your arteries. Typically, the arteries that we think of is the heart arteries. So if you ever get your blood pressure read, you'll notice that there are two different numbers. There's a number that shows up on the top or first, and there's a number that's at the bottom. The top number is called systolic. So that is the pressure of the blood during the heartbeat. And the diastolic number, which is the bottom number, is the pressure of the blood on the arteries between the heartbeats. This is how we measure blood pressure. Having higher blood pressure can be associated with a lot of different chronic diseases that relate to the heart. So high blood pressure can be caused by the buildup of plaque in the arteries. This plaque can be caused by a few different things. However, oftentimes it is caused by bad cholesterol. The buildup then makes it difficult for the blood to flow through the arteries. Usually, this type of plaque and blocker buildup is what causes things like a heart attack or a stroke. This can also sometimes cause a tear in the artery's lining due to the force of the blood, because as all this blood is trying to go through the artery, but there is little space for it to go through, the blood pressure becomes higher because the blood is trying to force itself through. So hypotension is whenever there is really low blood pressure. This is typically whenever someone's blood pressure is below 90/60. So 90 being the pressure of the blood during a heartbeat and 60 being get in between heartbeats. This really does depend on the individual. Some people may have lower blood pressure in general. However, this can cause the heart and brain to not get enough blood to function properly. It can often be a symptom of some other sort of pre-existing condition that should be evaluated by a doctor. It's also important to know that hypotension can lead to shock in some cases. So if someone is exhibiting these sort of signs, call 911 to get medical intervention as soon as possible. Some of those signs of shock could be cold and sweaty skin, rapid breathing, blue, purple, or gray skin, as well as having a weak and rapid pulse. And then hypertension. So hypotension means low blood pressure. Hypertension means high blood pressure. This is blood pressure that is above 130/80. Oftentimes, hypertension actually lacks any sort of symptoms. However, if you do have symptoms, that can indicate that there are other conditions, and sometimes certain symptoms only occur if there is some sort of life-threatening condition going on. So it is very important to keep an eye on blood pressure, because hypertension can be associated with a lot of different chronic health issues or health emergencies. So some of the dangerous symptoms to look out for if your blood pressure is high or if you feel you might have hypertension is things like headaches, nosebleeds, and shortness of breath. So it's very important to stay aware of this. And if you do notice these symptoms while you have hypertension, it would be a good idea to call 911. And then a hypertensive crisis. This is above hypertension. It is whenever your blood pressure rate is then 180/120. Typically, if you get a blood pressure reading of this, you're going to want to take a repeat reading about 5 minutes later. Sometimes the symptoms may mimic those of organ damage, stroke, or heart attack. So making sure that you keep an eye on those symptoms that we discussed in our previous episode about stroke and heart attack can be helpful for knowing if you might be having some sort of hypertensive crisis. Some of the symptoms to look out for, and if you're experiencing, call 911 immediately, is if you're experiencing any sort of chest pain, numbness, weakness, difficulty in speaking, or a change in vision. So as I mentioned, you should do a repeat reading about 5 minutes later. However, if you have any of these symptoms, you should be calling 911 immediately. If your blood pressure is still at or above 180/120 5 minutes later, if you don't have any symptoms, that would be considered a hypertensive crisis and you need medical intervention immediately. Why we talk about blood pressure so much, especially high blood pressure, isn't just because of things like hypertensive crises. It's because it's also a very high risk factor for other chronic conditions, such as having a stroke or having a heart attack, kidney problems, blindness or vision loss, congestive heart failure, dementia, or other sorts of cognitive impairment. And that's just a few. So high blood pressure is associated with a lot of different conditions. And it's important to keep an eye on your blood pressure so that you can minimize the risks of developing these sorts of conditions or having these sorts of emergencies. And then some ways to lower high blood pressure. So some examples of these that you also might need doctor's recommendation for is to increase your potassium intake, reduce your tobacco use and exposure, reduce alcohol usage, increasing physical activity, decreasing your sodium intake, and then trying to manage your emotional well-being, So just taking care of that mental health. Stress is oftentimes associated with high blood pressure. So even if it's not very much of a physical change, those mental changes make a big impact. Thank you so much for listening. Our next episode is going to be over the topic of cholesterol and physical activity.